42-year-old man who is employed as a construction worker presents to his primary care physician with complaints of moderate headaches and profuse sweating. He reports the need to carry out 3 additional shirt changes to work because they drench quickly even with tasks of low physical exertion. His co-workers have commented about his changing glove and boot sizes, which have increased at least 4 times since he joined the company 10 years ago. Physical examination is unremarkable except for blood pressure of 160 by 95, hyperhidrosis, noticeably large pores, hypertrichosis, widely spaced teeth, and prognathism. Which of the following best explains the patient's clinical manifestation? A. Increased serum epinephrine. B. Increased serum insulin-like growth factor 1. C. Increased serum cortisol. D. Increased thyroid-stimulating hormone. And E. Increased serum testosterone. So make a habit, if possible, of highlighting the important things in the question. Okay, there are headaches, profuse sweating. There is a changing glove sizes, hyperhidrosis, very large pores, biphasic prognathism. What is prognathism? Prognathism is protrusion of jaw. Even if you didn't know that, I think it will be okay. You'll still be able to answer this question. Okay. So what do you think? What is the diagnosis here? It's acromegaly, right? The patient's hand and foot size is increasing. There is protrusion of jaw. There is increasing space between the teeth, and also there is sort of large pores. So there is coarsening of skin. And another thing is moderate headaches. Now, the diagnosis here is acromegaly. Let's look at pathology here. Okay. GH hormone secretion is increased by GHRH from the hypothalamus. GH is released by anterior pituitary. Now it has 2 main branches of action. First is the direct action of GH, and this will act on the metabolic side of it. It will increase glucose. It has anti-insulin action. Almost all the hormones have anti-insulin action. Increase glucose, increase fat utilization. So increase lipid breakdown, and there is increase in protein synthesis. Okay, because it makes sense. Your growth hormone is for growth of tissues, so it will cause an increase in the protein, which can be utilized for growth subsequently. Now, another branch of its action is via insulin-like growth factor. Okay, insulin-like growth factor 1. Now, there are growth hormone receptors on the liver. These growth hormone receptors will act on their liver receptors and will cause the release of insulin-like growth factor 1 from the liver. Okay, liver will release this. This insulin-like growth factor will bring about all the other actions. That is, increase in the bone, cartilage, and will bring about the soft tissue growth. Everything related to growth here, right? So growth hormone brings about its action by insulin-like growth factor released from the liver. Remember this. In this case, most likely due to an adenoma occurring in the pituitary gland, level of growth hormone rises. It will act on its receptors in the liver, and the level of insulin-like growth factor 1 will reduce. Now, all of this, if it occurs in a patient after the closure of their growth plates, it is called acromegaly. And if it occurs before the closure of growth plates, it is called gigantism. The only difference is, in gigantism, even the height will increase. But once the growth plates have fused, the growth hormones will cause an increase in the soft tissue. Height will not increase. If it occurs after the closure of the growth plates, it is called acromegaly. There are effects of IGF will include increase in the hand and foot size because of accumulation of soft tissue there. There will be increase in the size of organs like heart. It will lead to cardiomyopathy. It will deposit in the larynx. Also, there will be protrusion of forehead, protrusion of jaw. There will be coarsening of facial features. Another feature is carpal tunnel syndrome because of accumulation of tissue in the carpal tunnel, which will cause compression of nerve. Let's have a look at other options. Increased serum metanephrine. Increased serum metanephrine will cause symptoms. Okay, see, you're sweating and hyperhidrosis, even increasing blood pressure can be a little confusing because this occurs with increasing serum metanephrine, which occurs in case of pheochromocytoma, when there is a increase in levels of epinephrine and serotonin and all of those. But it has characteristic symptoms. Pheochromocytoma. There is headache. There can be increase or decrease in blood pressure. There is palpitations and there is sweating. These these symptoms. Okay, there won't be any changes in the glove and boot sizes or the widely spaced teeth and other findings. These findings should lead you to acromegaly. Increase in serum cortisol. This is also very specific in exam. There will be like a buffalo hump, purple stria in abdomen, moon faces. If all of this is given, then you should go towards increasing serum cortisol, which is called Cushing disease. Increased serum thyroid stimulating hormone. This will obviously lead to increase in thyroid hormone synthesis, which has its characteristic features like tachycardia, diarrhea, weight loss, all of that, right? Which is not given here, which is not the case here. And increased serum testosterone, this is also a very rare tumor. Usually, increased serum testosterone will only be seen if the person is exogenously taking testosterone, and if we have characteristic features like increase in size, increase in body size, increase in muscle mass, erythrocytosis, loss of body hair, and sometimes even gynecomastia. All of this is seen in those taking exogenous testosterone, right?
Thanks for watching. Please give a thumbs up and subscribe for more.